Well, 14 days until I'm on the table. I'll be getting my bone marrow extracted, some adipose tissue harvested, and my PRP drawn. And then those will go to our lab, be processed, cleaned up a little bit, and injected into my intervertebral disc, one in my cervical spine and one in my lumbar spine, along with some other structures to help support those levels. Anyway, I've been doing a very good job of being compliant and sticking to my intermittent fasting regime, staying active, working out with the tonal. But the big news today is that my supplements have arrived. As part of the regenerative medicine procedure, similar to the idea with intermittent fasting and some of the other things that I'm doing, the healthier that I am, the better chance that these cells have of being healthy and then performing the job that we're asking them to do. So supplementation is something that we recommend for all of our patients having a regenerative medicine procedure. And since I'm gonna have it done, no different in my case. So let's go ahead and talk about what these supplements are. I'm excited to get these on board and get my cells nice and healthy and decrease my systemic inflammation. We use a website-based distributor for distributing our supplements so that it's really nice. You can pick and choose the ones that you would like and have them sent directly to your home. And the group that we use is called FullScript, and it makes it nice and easy for most everybody. So this just arrived today and just got home from work, and let's take a look. So first thing that I have is a very high quality turmeric-based anti-inflammatory product. So this is designed to be taken to help decrease my systemic inflammation beforehand. If I were taking something like NSAIDs, then hopefully getting this on board would help me to have that decrease in inflammation and have that decrease in pain, similar to the effect that you get with an NSAID, without having to take the NSAID, because the NSAIDs are contraindicated for our regenerative medicine procedures. Next, we've got a high quality multivitamin, and this is designed just to make sure my body is replete with all the vitamins, minerals, and nutrients that it needs, as well as specifically designed to help with my mitochondrial health. And one of the things that we know about stem cells is that one of their major mechanisms of action is by either donating their mitochondria to the local cells and helping them become more healthy, very altruistic, but also just by being that powerhouse and being able to generate all the different novel proteins and cytokines that are needed in order to heal the tissue. Next, we've got a high quality and very concentrated fish oil product. Now, I don't particularly care for fish, so this is a really important thing for me to have on board. But also, taking it at a therapeutic dose can help decrease our systemic inflammation. It also gets incorporated into our cellular membranes. So when we go through post-procedure and our body is healing, the cells and the tissues that will be responding and proliferating and healing, those tissues are going to be better prepped to be less inflammatory by getting fish oil on board. Part of the goal with these is to not only decrease systemic inflammation, but to help the recovery be quicker and for that recovery to be less painful. A real big powerhouse as far as supplements to get on board, especially for tendon issues or things like meniscus and cartilage issues, is to have a good high quality collagen. So this particular collagen is actually encapsulated, so I could take it that way. But there are similar types of collagens that are powder form. I just prefer the pill form. This is important because collagen was one of the main building blocks for a lot of the musculoskeletal tissues that we're going to be trying to heal. So I want to be replete on that and have that ready to go. And then the last product that I have in my kit is something called SPM Active. Now this is not to be taken before the procedure, but to be taken the day of and subsequent to help drive my post-procedure inflammation to resolution more quickly. There's some interesting studies even showing that surgeons, orthopedic surgeons, are using this product to help their patients recover more quickly from their procedures. So those are the supplements I'm taking. Now, if I had a particular joint like arthritic or degenerative condition, I would add another supplement, and that would be glucosamine chondroitin with MSM. That's really good for helping to decrease inflammation in joints, lubricate joints, and provides the building blocks for the cartilage. But since mine isn't quite my injuries aren't of that nature, I'm gonna elect not to take that one for this go around. Anyway, that's what I'm taking to prepare for my procedure, and what we routinely recommend for a lot of our patients.